Welcome back, loves. I'm so glad you could join me today, especially since I don't have a guest. And I think this is going to be the season where I just only have one guest, and we'll all have to be okay with that. Running a podcast takes a lot of energy when it comes to reaching out for guests and inviting people to be on, share their stories. And I have found that people are busy right now. I have two people I really want to feature on the podcast. They're both psychotherapists in different areas of the country, and both have gotten back to me and just said, "Girl, I am still interested. I am just so busy." Anyhow, we're back. And today we're talking about overcoming low self esteem in therapy. And before you have a chance to put it in the comments, I want you to know low self esteem is not a diagnosis, which you already may know. Why do I want to talk about low self esteem and how that's treated in therapy versus major depressive disorder, generalized anxiety disorder, bipolar disorder? Why do I want to talk about low self esteem? I think it's plaguing a lot of young people, and I think it's actually plaguing a lot of adults too. And I think that if we don't get it together as our generation, the older generations, then the younger generations will come in and they will not have learned the lesson about the things to avoid consuming, people to avoid being around, ways to enhance their self esteem, so on and so forth. We owe it to ourselves to work on it. I'm in my early 40s, right? And they are going to owe it to themselves to do the work too. So why not talk about it? Because low self-esteem can actually contribute to some of the diagnoses in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. So I outlined some information I want to share with you about how I treat, we'll use the word treat for the context of this discussion, how I treat low self esteem in therapy. I've mentioned in previous episodes that I always start out with a consultation. That's pretty much mandatory in my practice. I need to connect with the person. I like to do them via video so I can get a feel for their energy and their movements. And because I'm looking for that too, right? I'm really paying attention to body language, and I want them to see mine as well. And I want people to see if they vibe with me. Now, sometimes we've had technical issues and then we end up doing the consultation via phone. That's fine too, as long as we eventually get on video and meet one another. So first, let's talk about the history of the problem. I gather a little bit of that in the consultation. Sometimes people will usually say, I've had low self-esteem for years and I never thought it was something I could bring to therapy. And when I explore that a little bit, people will say, well, people go to therapy for the bigger issues. Low self-esteem is a big issue to me. And it is because it spreads throughout so many areas of a person's life. It can really impact your career, your professional life. It can impact you in parenting, in intimate and platonic relationships. So it's really a big deal. And I validate that need to work on it and that desire to work on it during that consultation. And let me give my disclaimer. I'm never talking about an individual client that I have worked with. Whenever you hear a podcast episode of mine, I'm always referring to themes of what I've seen over the last 15 years of being a psychotherapist. Okay. I'm never talking specifically about anyone in particular. So let's say I do a consultation with someone and they share the history of, or usually people don't share the history. Usually people just share, I'm dealing with low self-esteem, and I say, how's that showing up? Maybe give me a few examples if you feel comfortable, and they'll give a few examples. And then I'll ask, I want to understand what symptoms you're having. And when people hear that around a term like low self-esteem, they think symptoms. Well, if I was depressed, I'd have symptoms. If I had anxiety, of course I'd have symptoms, right? No, what are the symptoms? Like, how are you seeing this show up? Because you have low self-esteem, and if you're listening right now, I want you to fill in the blank. My low self-esteem has led to blank. Maybe that's decreased opportunity. Maybe that's increased anxiety. Maybe you've become depressed about it over the last 6 months. Maybe it's led to more isolation because you don't want to be around people, because you don't feel comfortable with who you are at your core and who people see you as externally. And so it's caused you to isolate. Maybe there's some experiential avoidance, which means you've avoided experiences. You've avoided exposing yourself to different places and around certain people. So you're really starting to close in and life is becoming very quiet for you. not because you want it to be quiet, because you put yourself in this cave because you don't feel comfortable with who you are at your core. So hopefully I'm giving you some examples of the symptoms. That's what I call it. So we explore those symptoms, and those symptoms can really stem from childhood. It can stem from an adult experience you've maybe had at one point in your life. We really just have to get in there and explore it, right? But I think I talked in a previous episode about the tip of the iceberg and what's underneath that iceberg. It's usually a lot that people don't see. So we tend to uncover a lot in sessions 1 and 2 after that initial consultation. So we're looking at those symptoms. I am specifically looking for anxiety or depressive symptoms in there. And any maladaptive behaviors, maybe because of low self-esteem, you drank alcohol and you started drinking too much. Maybe now it qualifies as alcohol abuse because you're drinking so much. Maybe there are some addictions in there. Or maybe you are engaging in some behaviors that are not healthy for you, which is the definition of maladaptive. You've adapted to a situation in your life, in this case, low self-esteem issues, in a negative way, in an unhealthy way, sometimes in the extreme, in a very toxic way, and it could impact you and others. So again, we're looking at those symptoms, and then I want to explore, how does self-esteem present in your personal and professional life? We have to go back to missed opportunities professionally. Maybe you're not speaking up in the meetings and people are saying they want to hear your voice more. They're asking for your feedback because they know you have expertise. That's why you're there. And you just don't speak up. Even though you're thinking of the right answer, you're thinking of the thing to say, you second guess yourself in your mind because your self esteem is low. So you can have all the credentials in the world. You can have the degrees. You can have received a lot of accolades historically about the work you've done in your community, at your place of employment, and you could still have low self esteem. And it could still cause you to play it small and be quiet at times where people are really looking for your leadership and looking to hear your voice. So I want you to think about that as we're going through these things today. So it could also show up in your personal life. Maybe you want to date and you're not. You're not hopping on those dating apps, which we could do a whole episode on that probably. Everything I hear on and offline about people going on the dating sites and how depressing that is for some people. And then you hear people who have the good stories. Anyways, I digress. Maybe it's showing up in your dating life because you don't want to get on the dating sites, or someone's trying to hook you up, someone you really trust, but your self-esteem is so low that you can't bring yourself to say yes to that meeting, yes to that date, yes to creating an online profile to put yourself out there, because again, you're engaging in experiential avoidance, and there's something you desire deep down inside, but there's something that's telling you you don't deserve it. We have to address that in therapy. So we really look at exploring those personal and professional avenues and how low self-esteem is holding you back, how it's showing up. Then what I love to do is identify the themes and any overlaps and how it presents personally and professionally. And that's a really fun part, especially because even outside of the presenting issue of low self-esteem, people don't often see how things overlap. They'll think, well, my childhood trauma only shows up in intimate relationships. And then I get in there and we start exploring and people are opening up. And then I point out a theme. And then people will say, oh my goodness, I had no idea that childhood trauma was specifically showing up in my interactions at work, or I was holding myself back at work and I had no idea that that was related to a specific childhood trauma. And so you can see how deep it can get, right? When you think about that iceberg, what's underneath it, sometimes it's childhood trauma. And so we also have to explore what you were exposed to as a child. And that part's very interesting for people. So I want to get an understanding of what your exposure was to positive role models, how your identity was reinforced, whether or not it was a healthy identity or not that was developing. And if it was healthy and positive, did you get positive reinforcement? Did you get any healthy deposits into your self-esteem bank as a kid? One thing I like to do with my kids, and they get a little conceited. You'll love their response. I'll say, do you know how beautiful you are, to my daughter and to my son? I'll say, you're so handsome. And they just kind of look shocked. And they're like, I know I'm beautiful. I know I'm handsome. Why do they respond that way? Well, because my husband and I have made deposits in them. Family members make deposits. We were FaceTiming with my sister earlier today, and she told my daughter, "Oh, you are so beautiful. You look just like your mom. You look like her twin." And she said, "Thank you," and smiled, you know? That was a deposit. So did you get that as a kid? And it's not just about that, right? I think it's 2025, so people have really highlighted how it's important to not just tell kids that they are beautiful. It's not just important to say, "Oh, you're great at sports." What are they great at intellectually? What are they great at mentally, emotionally, spiritually, right? So it's a fine line between you're either giving those healthy deposits to your children and or the children in your life. Maybe you are the favorite aunt or uncle, grandparent, godparent. You know, are you giving those positive deposits or are you not giving them? A lot of times if people are getting them, there's not too many times where they're not getting them, right? But if they're not getting them, then they're typically consistently not getting them. So I want to know what that looked like in a person's childhood because it can really impact their overall self-esteem because that's the foundation, your childhood. And then as you age and go across the lifespan, it starts to shift because you then start to have your own deposits and your own experiences. And if you don't know how to pour into yourself, well, then we're ending up in therapy and we're finally working on self esteem in the 30s, 40s, and beyond. So there's that. We also have to gain an understanding of your role in the family. You know, maybe you're a person who was parentified, which means maybe you were the eldest and you had a lot of responsibility in your family because one or both caregivers were working and you had to be the one to fix the meals, to get some of your siblings up. You felt a lot of responsibility and maybe you only got praise for that responsibility. So you're super responsible as an adult and you struggle to take a breather. You struggle to rest, to relax. You struggle to motivate yourself in certain areas because motivation and encouragement and applause only came when you were caring for others and not yourself. So there's a divide there. There's a separation between you and others. So you're such a giver externally. What about internally? That can impact your self esteem. So, as you can tell, your role in the family can also have a long term impact on your self esteem. And then finally, did you have a voice as a child and were you encouraged to use it? That's big. In my family, it would be unheard of when I was a kid to use my voice in the way that my children use their voices. They speak up a lot. They do it respectfully, you know, and at times it doesn't come off respectfully and we will let them know and they'll say, "Oh, well, why didn't you tell me?" And then I let them know, "Well, I'm telling you now. You're navigating a world that's still very new to you." And they're both under 11, by the way. So this world is still new to you. And so there will be things you say that can come across as rude or offensive. And it's just our job to correct you as parents and let you know, well, that's not really the way we say it. There's a better way to say it, you know? So they give us a lot of feedback. They have a voice in our family. When we talk about, you know, places we want to live at, they have a voice in that. When we explore family activities, they have a voice in that. So when you think about your childhood, and you can put this in the comments wherever you're listening to this episode, did you have a voice? Were you encouraged to use it? Because it's important when you think about the trajectory of your self esteem. If you didn't use it when you were a child and you're still not using it now, let's just take a person in their 40s. Well, it's time to start flexing that muscle and experiencing your voice in a different way so that you don't spend the rest of your life playing small and not speaking up when you need to. So that's a very important thing. And then the next thing I do is I ask, and I don't do this with everyone, right? Some people might have a healthy attachment style, and that's very clear in our talking together. And other people, I'm kind of curious, like, what is your attachment style based on those childhood themes, right? And so you can go to attachmentproject.com and you can actually take a free attachment quiz, and it will give you so much information about your caregivers. And I say caregivers to just be more inclusive because some people don't refer to the people who raise them as parents. So, whomever your caregivers were, it will give you what their attachment style is as well based on your answers. And so we take that report and we look at a person's current life and just look at those themes that are popping up. And so if you didn't have a healthy attachment to your caregivers growing up, well, that impacts self-esteem, right? If you never had an opportunity to trust an adult as a child because the adults around you weren't trustworthy, well, you may have a disorganized form of attachment. You may have a more anxiety-centered attachment style. So, it's very important to understand that in the context of treating self-esteem. And again, I let people know upfront there's probably more to this self-esteem presentation than you think, than I even think, based on what you're sharing with me. And I'm so eager to explore that with you. So I have people take that attachment styles quiz if they are open so that we can dig deeper into their attachment style and how it has changed over time. And we get a snapshot of where it's currently at. It's intriguing to me to look through that report and match it with what people have told me in the therapy sessions. It really is. And these aren't all, I put this down in order, right? And sometimes we're jumping to some of this a little earlier. I'll just say that because everyone's individual. So then we explore how people respond to their wins in life and how they respond to challenges. I think that's so important. If you are a person who does not celebrate your wins, I'm going to encourage you to do that right now. Pick a win, go celebrate it, okay? Because too many people are collecting wins, not stopping to celebrate them. And then they miss the opportunity for those wins to become healthy deposits into their self esteem box. I don't care how old you are, I don't care how young you are. Start doing that, okay? Start celebrating your wins. And then how do you respond to challenges too that can be impacted by your self esteem and how it presents? If you have low self esteem, well, we can conclude that it's probably going to be harder to overcome things because maybe you don't trust yourself again. Maybe you don't believe in your internal guiding system. Maybe you don't believe that you make good choices. Well, then it's harder to respond to life's challenges, right? Then we explore the presence of imposter syndrome. If low self esteem is present 9 times out of 10, you may be doing better than you think in a lot of areas. And if you were celebrating your wins, you'd know that, okay? But seriously, imposter syndrome gets us all. And I like to tell people it's something that, kind of goes up and down at times for different people. And that's normal. And there are times when people refer clients to me, and majority of how people find me is referral based. People hear about my work with other people they know, or someone recommends them to me, and they reach out, we do the consultation. But before that, right, I'm preparing for the consultation, and briefly I might forget who I am. I might forget how good I am at being a psychotherapist. And I can say that confidently because I have high self-esteem. I know I'm great at this, okay? You got to own what you're good at, and that builds healthy self-esteem for you. And if you have that imposter syndrome before a consultation or before a meeting, could be a fleeting thought. It could be something that's stemming from a stressor or a different life challenge, something you're not addressing. So it's good in that moment to say, where is this coming from? And it could also just be presenting as a little bit of anxiety, because you're meeting someone new. So I just check in with myself. Where is this coming from, girl? Because you know who you are, okay? You know the deposits you have made into the field of mental health. So hold up. And 9 times out of 10, it's something that happened earlier in the day that I didn't have time to properly break down or address. So I put it in my reminder, or I write it down so that I can address it afterwards. And I remind myself who I am, okay? So hopefully that's helpful for you too if you get a little bit of imposter syndrome before meeting with someone new, a consultation, whatever kind of work you do, right? Next, I probably provide some psychoeducation. I do that with a lot of clients if people are open to the, you know, form of literature that I'm going to share or the videos. Just something helpful, right? Sometimes people need to do some affirmations, so I have some empowering questions and affirmations that I can share with people. And those are in the form of documents that I send people digitally. And then, of course, I love to teach people healthy coping skills and strategies and how to address low self esteem. And I've already shared one with you, which is you notice some imposter syndrome is coming up. Where exactly is that coming from? Have you stepped out of your power? Have you forgotten who you are? Right? You might need to ask yourself some questions in that moment versus just rushing to log in and start that meeting or that session, because you need to do a check in first. You need to remember who you are, and that can be very helpful. Journaling is also helpful so that over time, you start to trust yourself more. You start to see the themes that are popping up in your life, see how you've responded to life's challenges, how you've conquered them. That builds self esteem when you can look back and see that you've made progress. Celebrating your wins is helpful to address self-esteem. Getting your anxiety under control so you can work on that in therapy, and or you might need to add in some medication through a consultation with a medication prescriber so you can get that anxiety under control. So you can practice some of these skills that we do in therapy with more ease. You may also have to get your depression under control. Depression is serious. So if that's present, well, of course your self esteem is off, right? Maybe starting a workout routine might be helpful for you. I had some health concerns for the first half of the year, and so my exercise routine was completely off. And as you can imagine, just mentally and physically, there was an impact. And I had to remind myself that this is temporary. You're getting medical testing done, you're figuring out what's going on, which everything is fine, by the way. Everything came back normal, thank God. And it threatened my self-esteem for a moment there, though. I had to decide in those moments of pause in my life, am I going to allow this to ruin my self-esteem? The self-esteem that I've worked so hard to build up in a healthy manner. And I decided that I wasn't. And it just can't be a mental decision, though. You can't just mentally declare it. You can't just vocally say it and declare it. There has to be some action behind it. You have to make deposits into yourself. So, again, addressing that anxiety, the depression, maybe there's a medical condition that's impacting your self esteem. Maybe it's incurable, okay? Because there just are some things that are not curable, even with modern science. And maybe what you do is focus on the areas of your disease or condition where you have control. And you're like, you know what? I'm getting my infusions and my injections, and I'm practicing my self care, and I'm keeping regular appointments with my medical providers. Maybe that's where you have the control. And maybe you use that to build your self esteem because that is you making deposits into yourself. These are just some examples because I think it's important that people understand what these strategies are. Sometimes if people have people really close to them, I will challenge them to go to the two people that they're closest to, maybe one if two sounds overwhelming, and ask them, what do you think my top qualities are? How do you view me? Because sometimes when other people that are close to us hold that mirror up to us and tell us who we are, it's a bit undeniable, isn't it? If you think you are a horrible parent or a horrible professional and you go to your colleagues or you go to someone in your family or maybe your partner and they're just saying all these amazing things about you, well, you have to acknowledge the gap between what you've told me in therapy and what they've told you, what they've reflected back to you. We have to talk about that difference because why do they see it completely different than you? Okay. It could be because of some of the reasons we've already discussed, right? Maybe you didn't get those types of deposits as a child. Maybe in adulthood, you didn't learn to give them to yourself. Maybe you didn't command people's attention and tell them who you are and how you will be treated, how you deserve to be treated. So maybe there were previous relationships before the one with your current partner where you weren't treated lovingly and you didn't stand up to that. You didn't say, I refuse to be treated this way until the end, right? So now you're in this new relationship and the person's giving you compliments and you can't receive them. They're going in one ear and out the other. Well, that's because you didn't learn and flex the ability to receive compliments, to actually let that deposit in, to actually let it become a part of your being and a part of the way you see yourself, right? It's very hard to believe when there's some toxicity around and when there are some unhealthy coping skills around and when there's unhealed trauma. It's hard to receive that. So there's a lot you can do with regards to coping skills, to increasing self esteem. Overall, I tell people these are lifelong deposits you're making, and it's not that it stops at any age. You have to continue to practice them. You have to continue to stand in your power, give yourself credit where it's due. You have to really work to celebrate your wins consistently. It doesn't have to be some big trip, right? Just whatever a celebration looks like to you. You have to learn to not only trust yourself, trust the people around you too who are telling you positive things about yourself. If you really respect them and trust their opinion, then why would they lie to you? Why would they say all these great things about you if they weren't true? You have to ask yourself that because when you have low self esteem, and maybe you have a mental illness alongside the low self esteem, it's really hard to believe yourself and believe others. So it's important, y'all. I'm telling you, work on your low self esteem. And then another thing I might do, especially at the end of an intake session, I'm pretty much taking you through sessions 1 and 2. Sometimes for most people, it's just in session 1, these are all of the things we're exploring. And some of that may spill over into session 2, which is no longer the intake. I may give a referral for a medication prescriber, a psychiatrist, or a psychiatric nurse practitioner just so you can explore the option of medication. I think it's important for everybody to just recognize that you don't have to work so hard at it. And I've been medication free for 10 years, and I've been able to do that because I practice the skills that I teach people, and I practice them on a daily basis, and they work for me. And I've needed medication before, and I don't remember dragging my heels when I first got prescribed psychotropics, because I was to that point where it was almost a little too late, like, oh my goodness, girl, this is bad. You're very hopeless. You're very depressed. You're crying all the time. This was in undergrad, my sophomore year, by the way. So it was, by that point, my grades were already bad, right? I'm already about to flunk out my second year in college. I don't even know how I made it through my first one. I don't want that for you. I don't want you to wait until things get too bad. And I know I'm jumping back and forth between low self-esteem and anxiety, depression, and maybe other mental illnesses. Whatever the case may be, if you are having symptoms, it is worth it to talk to someone who can help you sort things out, someone who could potentially prescribe medication to take the edge off of those symptoms so you can do the work to get better and learn the skills you need to carry you throughout your life in a positive way. And it's also worth it to do a consultation with a psychotherapist. And many of us can treat low self-esteem, right? This is a general one. However, hopefully I have clearly demonstrated that it can be tied to very specific things, such as unresolved childhood trauma, healing that's lacking in other areas, maybe in relationships, maybe your communication patterns have been off for years. Maybe you're struggling with anxiety and depression. So you definitely want to do a consultation and make sure that the psychotherapist can treat some of those conditions that may be riding along in the car with low self-esteem. Okay. I really hope this episode inspires someone to consider therapy. That is my mission in creating this podcast. I want you to have a life where anxiety is present because it's something we need ultimately, and you're also living a life of freedom. If you have depression, I could have called this podcast so many things. If you have depression, I also want you to access your freedom. If you have childhood trauma that you're working through, I want you to access your freedom. If you have low self-esteem, I want you to be able to work through that and access your freedom, because freedom is available for you. You will have to work for it, okay? That's the disclaimer. Therapy is work in and outside of the session, and it's so worth it, and you deserve to have the freedom that comes from putting that work in and having an amazing psychotherapist pour into you. That's what you deserve. Okay. All right. I'll see you in the next episode. If you have any feedback about this episode, any comments, just anything, let me know. If you like the format of audio over audio and video, any feedback, put it in the comments section. Let me know. I'll see you next time. The Anxiety and Free podcast is sponsored by Find My Therapist, connecting you with therapists at findmytherapist.us. If you found today's episode helpful, please share it with someone who might need it. Tune in next week for more conversations on navigating mental health and finding your freedom.